today we're going to be applying an artesant wound graft for this diabetic pressure ulcer. This is the third graft this patient has had placed. And we're going to be doing it in the office setting, so I'm going to show you guys how easy it is. First, and I'll show you guys that we're doing this socially distancing and we don't have any assistance because we're trying to be cautious here. Then you put on the gloves and it just cannot be any easier. I prep the wound site. It's important that you don't want to use betadine when you're prepping the wound because we don't want that betadine because it is sometimes not good for the graft. So we have this prepped. The next step, is we're going to debride the wound. And so I think that this is probably the most critical step that sometimes people are not aggressive enough with. We want to make sure this is a red granular wound base so that the graft is going to take. And so you really shouldn't be shy about this part because if you're not debriding all that dead tissue, this isn't going to take well. So I'm excisionally debriding the wound. And our patient is not numbed because she is neuropathic. So you can still feel me touching you, right?
A little bit.
But it's not painful like you would think it would be if somebody could actually feel this. And so I am okay with this bleeding. I want it to bleed. So you shouldn't be afraid of that. So we have a nice red granular wound. Now, I've already pre-measured this, but I know that this graft is going to take a 2x2. And so I'll show you guys, the reason why I like these grafts is because they're so low profile. So this is not big and bulky, but this is infused with all those growth factors. It's non-immunogenic. It's going to take right to this wound. And now that I have it nice and red and granular as far as the wound goes, we're just going to place it right on. And I want there to be a little bit of an overlay, but not much. Now the next thing that you don't want to miss is this should be a piece of adaptic or something that is not going to stick to the wound, and then saline moist gauze. And I don't mean just a little bit of saline, I really drench this piece of gauze with it because I don't want to dehydrate the wound. I want it actually, or the graft. And then I take some dry ones too to reinforce it because I was aggressive with my debridement. And then we wrap it up. So as you can see, this is really not technically difficult, but the benefits that it gives the patient really can't almost be measured just by infusing that wound with those growth factors, and then with the debridement in addition to try to stimulate some bleeding and some healing to the wound site. And so also be careful when you're bandaging this. Really bandage it up a lot because you use that saline moistened gauze. And so this might leak through, and I always tell my patients too, don't be worried if this leaks through, as long as it's not dripping anything. A little bit of strike through is totally fine. I want it to strike through, because that means you bleed, right, which we need to heal. So we'll do something, and this doesn't have to be a gigantic bandage either. You do something like this, get her all bandaged up, and if debridement is a secret to this graft taking well, the next unsaid secret is offloading, right? So here we have an offloading boot for the patient, and we have it offloaded, and she also is walking with use of a cane and sometimes a crutch too, so that she takes pressure off of this. And we stick this little foot in there, make sure she's all the way in. And so she'll leave this bandage clean and dry and intact, and we won't see her back in the office for a week, but we will leave the graft intact and really won't start debridement for 2 weeks because we want to make sure that graft completely takes. So we'll get her all situated in here. And so it's really easy for the patient. It's something that's super easy to be done in the office. You can see here I did it without an assistant. And it's really spectacular what you'll see that wound look like when she comes back in a week too. She's all set.